Okay, my name is Stephanie Ajuma Okoriko. I'm the program manager working with Nigerian Sex Worker Association. I give a global health promise concept to post the video on all their social media platform, and also they can share it with funders. Thank you. One of the global health promise maternal health project we are doing, this is the first time we've done that in Nigeria. All the funders funding sex worker, the only thing they talk about is HIV or gender-based violence. But we have other pressing needs, sex worker, pressing need of sex worker. Like the maternal health is a very big issue. Most of the women will carry to the hospital. Will find out when you ask them, most of them will tell you that they are just 7 months pregnant or 8 months pregnant. But after doing this scan, we find out that they are more than 7 months. Like one particular woman, when we asked her, there's a particular form we fill before taking them to the hospital. When I was administering the form to her, I asked her how long is the pregnancy. She told us 7 months. But when we got to the hospital, we found out that she's already 41 weeks and is long overdue. When the doctor did the scan, she found out that the water is already drying up and the umbilical cord is already strangling the child. Had it been they did not carry out the CS they did yesterday, I don't think she will end up losing her life and the life of the child, because she never had a plan of going to the hospital to give birth. What she was already thinking about is how she is going to give birth at home. All the women that we took to the hospital, when you ask them, where did you plan to give birth, most of them will end up, I don't have money to go to antenatal. The only place I was thinking of giving birth is at home. So imagine, we didn't take that lady to the hospital, maybe she might end up losing her life and the life of the child. So we really want to appreciate Global Health Promise for bringing this program to the sex worker. We are tired of hearing HIV. Now we have another program, like the maternal health care program, that is really helping the sex worker. Most of them go to now after taking them to the hospital, we buy their mama care, everything about their delivery. It was paid by Global Health Promise, and at the end we still have nutritional pack, like food item that will go a long way for she and her baby and the children she has at home. Even the antenatal transportation for the antenatal care is also paid by Global Health Promise. And we also look for that if we can even extend this project to other states. This thing was done in 3 states. Like in the northern region, they need something like this, because the rate at which mothers, sex workers as a whole, lose their lives when giving birth in the north is alarming. So if they can even find a way, like if Nigerian government, other funders can learn from what Global Health Promise is doing for sex workers concerning maternal health, will really go a long way, so we can support other sex workers, not only in Abuja, Lagos or Calabar. Like if we can do it in all over the state in Nigeria, it's going to go a long way. And we really appreciate Global Health Promise, and we look forward in working with them. Thank you.